Friends, PragerU community, as you know, we've been trying to bring you updates on how our beloved Dennis Prager is recovering. And I have a very special one for you this time because I'm in touch with Dennis's brother, Dr. Prager, Dr. Kenneth Prager. And he is not just a brilliant doctor, he is also a family member who has been following very closely how Dennis is recovering. And so I want you to hear directly from him how Dennis is doing and maybe some hopeful messages that all of us can go into the weekend with. So Dr. Prager, thanks for coming on. And maybe you could just briefly share with us what you do. You're a pulmonologist?
Yeah. So what I do, Marissa, first of all, thank you very much for having me. It's sad it's under these circumstances, obviously. I would much rather be speaking about medical ethics or pulmonology. But what I do is I've been a doctor at Columbia for 51 years, primarily involved in treating people with pulmonary disease, with lung disease, but also some degree of internal medicine. I've also been involved with the medical ethics department here at Columbia for 30 years, where we do clinical ethics consultations for patients in the hospital or outside the hospital. And recently I've also got a new job as the Associate Dean for Professionalism, where we deal with people who are not getting along with each other, subtle situations, sensitive situations like that. But in terms of Dennis then, so obviously I was shocked, as was the entire family, when I heard about his accident. I believe it was David who called me, and I flew out to LA the night. I saw him the day after he fell, when he was in the ICU at Cedars-Sinai. He had just been transferred, was obviously on the ventilator. I think he was aware of my presence because he did smile when I jiggled him a little bit and said, "Hi, I wish," I said, "you really had to go to this lengths to get me to visit you?" He smiled, but he has no recollection of that. And since then, I've been keeping up to date with daily emails or WhatsApp with the whole family, and his wife has been keeping me up to date as well. So in terms of a spinal cord injury of this nature, I am unfortunately all too familiar with this because my son Joshua had the exact same spinal cord injury, C3, C4, the third and fourth cervical spinal segments. He was in a motor vehicle accident in Israel in 1990, 34 years ago, which almost killed him. And when I flew out to Israel to see him right after the accident, he was quadriplegic on a ventilator. And after a months long, really a year, made a significant recovery to the point where he was able to walk again, which is very unusual for somebody with a spinal cord injury like that. But he is paralyzed and has been paralyzed on the left side of his body ever since. That hasn't kept him, though, from having a magnificent career in journalism. And he's an amazing author, wrote a book that was nominated for a Pulitzer, The Family Row. So I know a lot about spinal cord injury. And ironically, Dennis and my father, Max, the last 2 years of his life, had a spinal cord injury which left him paraplegic, paralyzed from the waist down. That was as a result of a medical procedure when he was 94 years old, when he had to have an aortic valve replaced, and it resulted in a stroke in the spinal cord. So 3 close members of my family, immediate family, spinal cord injuries. So Dennis, the key thing now with Dennis, first of all, he's awake, he's alert, he has a sense of humor. The key goal right now is to get him off the ventilator. When somebody has a spinal cord injury in the area that Dennis has, it affects the nerves that go to the diaphragm. The diaphragm is the major muscle of respiration. It does most of the work of breathing. People may not realize it, but breathing is work. It's physical work. And normally we don't experience stress in doing it because we're healthy. But if the diaphragm is weakened as a result of the nerves that go to it being impaired, as they would be in a spinal cord injury, your breathing is impaired. And the fact, though, that Dennis is making significant progress in getting off the ventilator is a very good sign, and very hopeful that he will ultimately be entirely liberated from the ventilator and be able to talk and even resume his radio shows at some point. That is obviously our hope. His mind is fine, and he will bring to the table, obviously, should that happen, and we all hope it does, a whole new perspective and a whole new field in which I'm sure he will have interesting, intelligent, insightful things to say, as he always does, about what it's like to be as sick as he was. So he has made significant progress. I think it's about 5 weeks since he fell, and he's getting there. He's getting there to be off the ventilator. Having said that, there's also, of course, the problem of movement and the paralysis. And so right now, Dennis does not move his arms or legs. And the hope is that he will make a recovery of some degree, as my son did. And I would say in that area, it's somewhat hopeful, because at some point he seemed to be able to move a toe, I remember, on command when I was there. So he has what we call an incomplete injury of his spinal cord, where there is some motor activity that is going on. He also, another good sign is the fact that he has sensation in his arms. If you touch him, he feels it. So the nerves the sensory nerves are able to function properly. Usually somebody with a spinal cord injury like this, you have to wait before saying this is it for several months. It can take months for there to be some degree of recovery of motor, sensory function, getting stronger, etc. So it's far too early to say with a definitive way what Dennis's prognosis will be in terms of movement of motor activity. So that's where we're at. Each day, we take one day at a time. The prayers of hundreds of thousands of people probably of Dennis. I know when I go to synagogue, I'm accosted by fans of Dennis who ask me how he's doing, want to know his name in Hebrew and his mother's name, which is the traditional way of making a prayer for a recovery from a serious illness. And so if the prayers of individuals can help, Dennis will be helped. There's no question about that. So I think that's where we stand in the big picture.
Doctor, this past week, I've heard some good news about Dennis's ability to breathe both without the ventilator and without the CPAP machine. And I've heard that they're very likely going to cap the trach, and that would allow him to speak. Can you explain that to me?
Yeah.
And is that really something to be significantly optimistic about?
Yes. So weaning somebody from a ventilator, which is something that I've been involved in as a pulmonologist for decades, it's a step-by-step thing. The ventilator initially takes over all of the work of breathing, basically blows air into your lung, positive pressure, your muscles have to do nothing. As you wean the patient, you turn down the amount of work that the ventilator does, allowing the patient to do more work in assuming the work of breathing. And that is what has happened with Dennis. They've gone from what's called assist control to CPAP, CPAP, continued positive airway pressure. And then after CPAP basically means that the person can initiate a breath on their own, and the machine only gives them a certain amount of positive pressure to breathe. The rest they have to generate themselves. If you're doing well on CPAP, the next step, and by the way, Dennis got a tracheostomy very early on because it was clear for his own comfort to take the tube out of his mouth and have the tube connected to his trachea, which frees up his mouth so he can move his lips, try to talk, and so forth. So he's at the stage now with his tracheostomy where they can actually take him off the ventilator for periods of time where he is breathing entirely on his own.
We will finish the prognosis of Dennis Prager by his brother, Dr. Kenneth Prager, in just a few minutes. Thanks for watching these clips from The Larry Elder Show. If you enjoyed this content, be sure to subscribe to my channel and hit the bell icon so you never miss a moment. More thought-provoking discussions are just a click away, so stay tuned, and we'll see you in the next one.